Now we have Dr. Tim Callahan from the Texas A&M School of Public Health to dig a little bit deeper into what this bill actually means for us. Dr. Callahan specifically studies health politics, the health insurance marketplace, Medicaid, and much more. He's an assistant professor over there at the School of Public Health. So, Dr. Callahan, let's start with what is staying the same. And one of the big things there is that health insurance companies still cannot deny coverage to folks with pre-existing conditions. Why do you think that was so important to keep that one the same?
Well, I think that one was so important to keep the same because individuals like it so much. When you look at public opinion polls, that's one of the two most popular provisions within the Affordable Care Act, is that insurance companies can't deny individuals because of pre-existing conditions. Now, the other very popular provision that's also going to remain the same is individuals being allowed to stay on their parents' health plans till age 26. Now, both of these were incredibly popular, and President Trump had said from the start that he wanted to make sure those two provisions were maintained, and they both will be under this plan.
And indeed they are. Okay. So next, this legislation, so it does have a plan for helping Americans pay for health insurance, but it's not subsidies like it was under Obamacare. It's now tax credits. Why is that difference significant?
I think in the long run you won't see too many changes as an individual. It might affect when you're going to be paying, and you might be paying on the front end and getting tax breaks back, as opposed to the government covering on subsidies on the front end. But effectively, you're still going to be going on to these marketplaces to look for coverage, and through that process, those tax credits are going to be based on your income. So if you're less wealthy, you're going to have a larger tax credit, and they're also going to be based on age. And the age part is something that's new. So now someone who's 60 is going to have a higher benefit level than someone who's 30, let's say. And between those two, you're going to see some changes in the structure, but that's a bit more technical. But generally speaking, there will be changes, but it's still going to affect taxes.
Sure. So getting rid of the individual mandate completely. Of course, under Obamacare, every American was required to have health insurance, or you would face a financial penalty, arguably one of the most controversial parts of the Affordable Care Act. So now, if this is passed, which we assume it probably will be, it'll be gone. So what does that mean, not just for individuals, but for the healthcare system as a whole?
Well, the original goal of those individual mandates was to ensure that people signed up for coverage, because if only the very sick who needed coverage signed up, then you'd have a very sick pool that was very expensive to insure. So the individual mandate was designed to get those people to enroll. Now, it didn't work out exactly as people expected, and it wasn't a very popular provision, so that's going to be gone. And in its place, there are going to be penalties for those who decide to not have coverage and then get it when they get sick. So that's how they're trying to ensure that insurance companies don't bear the burden of very sick insurance pools. But the individual mandate wasn't popular, and I think there'll be widespread support for its elimination.
Sure. So a lot of folks, I mean, we all know anecdotally, and we saw all the stories after Obamacare becoming very unhappy with their insurance premiums, even if they were insured before the Affordable Care Act. Will that change? Is this the beginning of a reversal of those hikes on the premiums?
I think a little bit of that is yet to be determined.
Yeah.
The bill came out yesterday, and the Congressional Budget Office, which determines the cost and who's going to be covered by these programs, hasn't even scored the legislation yet. So we don't know that. With that said, one of the new provisions is designed to potentially eliminate that issue and make it more affordable, and that is that under the old law, you could only charge the elderly 3 times more than you could charge a young person in insurance. But under the new plan, you can charge them up to 5 times more. And the thought is that if you're charging the elderly, who are taking up a lot of care and are very expensive, more money, you can potentially make it cheaper for most people.
Interesting. Okay. Medicaid seeing some changes, right? Some caps on the spending on Medicaid. Break that down for us.
Yes. So for the first time since 1965, when Medicaid was passed, they're going to be switching potentially to a per capita payment, which is per person. Under the current way it works, individuals get Medicaid services, and the federal government pays a certain percentage. No matter what the total cost is, they pay a given percentage. Under the new plan, they'd pay per person, and that per person amount would not change, so there would be a hard cap and a hard amount that the federal government is willing to pay. So that is a big change to happen under this new law.
Sure. Interesting. Well, Dr. Tim Callahan, healthcare, obviously always a complicated issue in the financial side and the politics side, and of course on the healthcare side. So thank you for breaking down some of the major points for us and how it could actually affect us. Appreciate you so much.
Thank you for having me.